Hi, I'm Sam from the Queensland Ambulance Service. Can you tell me your name?
It's Jimmy. Where's my family?
My role as a paramedic is to provide emergency pre-hospital care. Introducing myself to the patient is vital as it provides clarification, acknowledges concern and builds empathy. So your family's been stabilised and they're on the way to the hospital now, and I can give you medication for your pain.
Okay, as long as they're alright.
Family is really important to Indigenous Australians, so advising Jimmy of the condition of his family reduces stress and builds trust in relationship. So Jimmy, you've done some damage to your leg, so I need to stabilise you and apply some bandages before we head to hospital with your family. Is it okay if I touch you?
Yeah.
Gaining consent before touching a patient is very important to Indigenous Australians. During a patient handover, the paramedic becomes the voice for the patient, so it's crucial that the paramedics and the emergency department staff collaborate effectively to ensure that the best decisions are made for the patient. Paramedics should communicate any recommendations that they have here as well.
I work alongside ancillary staff to ensure airway, breathing and circulation management occurs and connect necessary monitoring equipment to better assess and evaluate Jimmy's condition. From here, my fundamental role is to liaise between patients and their family, physicians and ancillary staff. As an ED nurse, I'm in a pivotal position to communicate with Jimmy, address his immediate concerns and support him through this traumatic experience. Hi Jimmy, my name's Simone. I'm an emergency nurse. Sally tells me that you're worried about your family.
Yes, where are they? Are they okay?
I've just been informed that your family have arrived at the hospital. They're in the rooms next to us. The doctors are looking after them now. Through patient-centred communication, I can keep Jimmy well informed about what he and his family's health status and treatment is, which is important in reassuring the patient and making him feel safe.
Jimmy seems really worried about his family, so just make sure you cater for that.
Thanks, Sally. Will do. Hi, Jimmy. We met earlier. My name's Simone. Now, you've developed a staph infection, so wound care, antibiotic administration and infection control is important. I'm also going to collaborate with the pharmacist and podiatrist to minimise impacts of immobilisation and the risk of deep vein thrombosis.
Alrighty, as long as you do right by me and my family. Put us all in this place for who knows how long. I feel so guilty. Don't like being separated from them. I don't know how they're being treated. I feel ashamed that I put my family here. I don't know if these health professionals are treating us well. I mean, back at home it isn't so bad. I get my fair share of input, but here I don't even know if that input's recognised. I don't even know if I'm being properly catered for as an Aboriginal man.
I know this is a difficult situation to be in, but we are all here to support you and your family to make a full recovery. Now, with your treatment plans, we're going to collaborate with a variety of health professionals and involve you in every step of the process to ensure your needs are being addressed. Just let me know if you have any questions. Health for Aboriginal patients encompasses a multitude of factors, including the physical, mental, cultural and spiritual health. Therefore, nursing is required to be holistic, whilst engaging the patient in shared decision making. This will ensure that care is patient-centred and culturally safe.
Don't know how we're going to cope at the hospital. I mean, I won't be working for a while. Well, I need to talk to somebody. We need some help.
Well, let's focus on your recovery right now. I'll talk to an Aboriginal healthcare worker. If that's okay by you, they can support all your financial concerns.
Awesome.
Hi Jim, my name's Tom. I'm a pharmacist at the hospital. How are you going today?
I'm okay, thanks.
Alright, would you like me to explain what I do here?
Yes, please.
Alright, so my job is to help prepare any medications ordered by your doctor and also help educate you about any of your medications, like what might happen if you take it, what it's for. Okay. Do you mind if I ask you a couple of questions about your previous medical history?
No, not at all.
Alright, are you on any regular medications at the moment?
Yeah?
You are? What are you on?
Oh, I've got diabetes. So,
Okay. Alright, do you use any natural remedies at home?
No, I don't, but my wife does.
Okay, so you don't. Alright, your doctor's prescribed a drug called vancomycin. So what vancomycin does, it's an antibiotic, so what they'll hopefully do is get rid of your infection. Unfortunately, with antibiotics, there's the possibility of getting an antibiotic-resistant infection which can't be cured using antibiotics. Do you understand?
Yeah.
Alright, I'm going to come visit you later on today to see how you're going. Is that okay?
Yeah.
Alright, it's been great to meet you, Jim.
Thank you.
Good morning, Jimmy. My name is Ben. I'm a medical imaging technologist, and it's my role to produce high-quality medical images that assist other medical practitioners in the treatment and diagnosis of your injuries.
How does that help me?
Well, I will assist you in understanding the procedures that you've undergone in terms of medical imaging, whilst also consulting with other disciplines to explain the results. So Jimmy, your medical conditions were extensive. You had multiple leg fractures, lacerations and penetrating injuries. Therefore you will need scans of both left and right legs to determine the cause of the pain. Is that alright with you?
Yeah.
Following the images that were taken, we need to insert pins and plates in your lower legs. This has developed a distinct limp. However, I'll work with an interdisciplinary team of nurses, pharmacists and podiatrists to provide care that will allow you to cope with your conditions and injuries. Thank you for your time, Jimmy. I'm now going to discuss further with my colleagues.
Okay then.
Tom, since you've had extensive surgery, you'll need a variety of pain relief, which we can provide.
Will do.
Summer, now that we have the plates in place, we need to collaborate to find the most appropriate care plan for Jimmy's health and consider his family. Therefore, we will need to communicate effectively with his family to plan rehabilitation that not only works for Jimmy, but also considers his family and their conditions.
Not a problem, we'll sort it out. Mr. Lovegrove, my name is Summer and I'll be involved in your multidisciplinary team as your podiatrist. I'll be accompanying you on your entire journey throughout the acute, rehabilitation and community healthcare settings in order to assist you with the treatment and recovery of the injuries sustained in your feet and lower limbs. So Mr. Lovegrove, the medical imager has explained that your legs have been pinned and plated with ulcerations on your right leg and a golden staph infection. Is that right?
Yes. Yes.
What are your goals relating to the recovery and mobility that we can work towards?
I want to be able to walk up and down the sidelines, coaching my rugby team, and to continue having an active lifestyle with my family.
Okay. Yes, so as soon as your leg ulcerations have adequately healed, I will work closely with the nurse to begin rehabilitation sessions. These will focus on regaining your functional independence while walking, so you can continue to live an active lifestyle with your family.